The respiratory system is a biological system consisting of specific organs and structures used for gas exchange. Some of the illnesses that may happen in the respiratory system are bronchitis, emphysema, cystic fibrosis, pleural effusion, and pneumonia. Bronchitis, which is contagious, occurs when mucus fills the bronchial tubes, causing inflammation of the area. This leads to severe coughing, shortness of breath, and coughing up mucus. The best way to get rid of bronchitis is to stay in areas with high humidity to help clear up your airways, drinking lots of fluids, and taking over-the-counter pain relievers to reduce swelling and inflammation. Emphysema is a lung condition that causes extreme shortness of breath due to damaged alveoli. The walls of the air sacs rupture, creating large open air spaces instead of small ones. This causes less surface area that can filter out oxygen, and thus less oxygen to give to your lungs. Cystic fibrosis is when the body produces a thick and sticky mucus that clogs the lungs and becomes an obstacle for the pancreas. The mucus is extremely hard to cough up and can lead to severe lung infections like bronchitis and pneumonia. Some symptoms are salty tasting skin, persistent coughing, shortness of breath, wheezing, poor weight gain after excessive appetite, greasy stools, and fleshy growths found in the nose. Cystic fibrosis currently doesn't have any cures. Pleural effusion is the buildup of excess fluid in the flaps of skin separating the lungs from the chest cavity. Normally there's a small amount of fluid in this area, but people with pleural effusion have an abundant amount. Some symptoms are chest pain, non-productive coughing, shortness of breath or difficulty of breathing, and the inability to breathe unless a person is sitting up. The liquid found in the area can also lead to cancer, making pleural effusion a very dangerous disease of the respiratory system. There are two types of pleural effusion, protein-poor transudative fluid and protein-rich exudative. The causes for transudative pleural effusion are heart failure, pulmonary embolism, cirrhosis, and open heart surgery. The causes of exudative pleural effusion are pneumonia, cancer, pulmonary embolism, kidney disease, and inflammatory disease. There are many different types of pneumonia, but all are caused by the lungs becoming filled with pus or another liquid. Single pneumonia is when there is pus in one lung, double pneumonia is when there is pus in both lungs, and lobar pneumonia is when there is pus in a lobe. There are 4 stages of pneumonia: congestion, red hepatization, gray hepatization, and resolution. The congestion phase lasts about 2 to 4 days and named because of a firm liver-like consistency. The affected lung is red-pink, dry, granular, and airless. Red hepatization is essentially the same as the congestion phase, except for the solidification of the alveolar parenchyma. During the gray hepatization phase, the lungs turn gray and the degrading of red blood cells start to happen. Macrophages start to appear, which are large phagocytic cells found in the stationary forms in the tissue or as a mobile white blood cell, especially at sites of infection. During the resolution phase, phagocytosis of the bacteria-laden leukocytes occurs, which is when the cells eat or absorb other cells, leading to a decrease in cell count.